Hi, I'm Dr. Cyril Randazzo, one of the neurosurgeons and partners at IGEA Brain Spine, serving the tri-state area in New York and New Jersey.
Hi, I'm Dr. Adam Lipson. I'm also one of the neurosurgeons and partners here at IGEA Brain Spine.
So Adam Lipson is one of our spine specialists in our practice, and today we're going to talk about spinal cord tumors. Not a very common occurrence, but a very important occurrence. Adam, what is a spinal tumor?
Thanks, Cyril. So I look at a tumor by definition as a growth, and there are benign growths and there are malignant or cancerous growths. Fortunately, most spine tumors are benign. We do deal with them as malignant entities once in a while, but fortunately, not too frequently. They obviously drive a lot of anxiety and concern for our patients, and we have a fair amount of experience taking them out.
Is it cancer? Is a spinal tumor cancer?
It can be, if it's a malignant one that grows aggressively and is invasive. Generally, they're benign and they're outside of the spinal cord.
Mm-hmm. So are they something that you can cure for someone?
Yes, absolutely.
Okay. And what are some of the symptoms that someone might have if they had a spinal tumor?
So they're generally picked up on imaging. They can be picked up incidentally, but the ones that are symptomatic, they usually give pain that's worse at night, can wake someone up from night. You can have severe numbness, weakness, any sort of symptoms of compression in the spinal cord. All those things can cause
so in your legs, would you have weakness in your legs?
Yeah, you can have weakness in your legs or your arms.
Okay. And how about the pain? Is it a constant pain? Or?
No, it's usually a pain it can be constant. Generally, it's a pain that comes and goes and usually wakes people up at night is what we classically teach people.
Okay. And if you have to have surgery on a spinal tumor, does that mean that you're going to have your spinal cord manipulated?
Varies. I think it's individualized for the patient and for the type of tumor that you deal with. Through many techniques, we can avoid manipulating the normal tissue and really focus on the spinal tumor. And we use things like lasers, ultrasound, microscope to really enable very careful, meticulous resections of those tumors so the patient's symptom-free.
And is surgery, do you always have to have surgery, and is that the only option to treat tumors in the spinal cord tumors?
No, it's not the only option. Generally, you're in that situation where you're either following something that's small and not growing significantly, or you're taking it out. Once in a while, we have radiosurgery and other techniques that can treat that tumor in a focal way.
The radiation that you talked about, what kind of radiation is that?
Well, it's usually stereotactic radiosurgery and is using a single focused beam of radiation. The CyberKnife system is an example, using some of the Gamma Knife, some of the other stereotactic radiosurgical systems available in the market, but they all accomplish the same thing of applying a radiation field to the tumor bed to kill any residual tumor or margins. And the thing I would recommend for our audience really is that this needs very dedicated neurosurgical care, and really neurosurgeons are the experts in this area, and everything's got to be individualized to that patient and their goals.
Great, thank you.
Thank you.